Hi everyone, I'm Dr. Jyotsna. We had a 54-year male known case of COPD came in severe respiratory distress requiring mechanical ventilation. After some time, junior doctor comes and says that the patient is in refractive shock. He has restricted with fluid. He has ruled out any pneumothorax or cardiac tamponade. The echo is normal. There is no sign of sepsis. What to do? The Mr. Magician, our senior doctor, comes in. He disconnects the patient from ventilator and change the respiratory rate and tidal volume on the ventilator setting to decrease the minute ventilation and reconnect him to the ventilator. Ask to nebulize the patient and target pH not PCO2 and allow permissive hypercapnia as it was dynamic hyperinflation.